Hello, and welcome to today's MHIMSS webinar, Secure Enterprise-Ready Text Messaging and Collaboration for Care Coordination, sponsored by IQMax. Attendees of this live webinar will gain a better understanding of the critical role that secure messaging plays in patient care, including leveraging smartphones for secure text messaging and collaboration within healthcare, improving care coordination with messaging, and alerts and tasks. Our first speaker today will be Paul Adkisson, founder of IQMax. With more than 15 years of experience in mobile technology solutions, Paul is a recognized leader in the field of mobile healthcare technology and has been active in leading technology, telecommunications, and healthcare conferences, including HIMSS, AHIMA, and CES. Paul has also been interviewed by a variety of publications, including the Wall Street Journal, USA Today, Health Data Management, and For the Record. Our second speaker today will be A.J. Patefield, Senior Vice President and Chief Medical Information Officer for Novant Health. And now I'd like to hand it off to Paul to begin our conversation.
Thank you. I appreciate that. I think mobile computing today is really ubiquitous, and it's really everywhere. In fact, it's really hard for me to find anybody who doesn't have a mobile computing device under the age of 12. And the fact that these mobile computing devices are crossing really from a consumer standpoint into the enterprise, and people are using them, in fact using applications to really drive better care and utilize that during their daily work is pretty much the normal now. So the need for mobile care coordination is an absolute. And so in order to have this efficient care coordination, care team members need to have the right information at the right time. The best way to accomplish this is to take advantage of existing technologies already being used. In fact, these smartphones and tablets and devices are really on the hips of your employees right now. In fact, as we're in this webinar right now, you have employees utilizing those technologies both in a professional standpoint and in a personal standpoint. So to leverage them only makes sense. So our tools need to support highly mobile clinical workflows. A Kaiser Permanente study indicated that doctors walked an average of 6 miles per day, and nurses walked 2 to 3 miles per day. So utilizing one device and prioritizing and responding to key events is critical in streamlining care. Now, I did say utilizing one device. You'll see that our solution is built around using any type of device. So being able to provide real-time relevant information to help doctors and nurses efficiently make decisions on patients' care. Transforming and transferring patient care from one team to another smoothly is a challenge. The handoff can be poorly managed if the right information does not get transferred to the next team. So a centralized system to capture and transfer information by team members is absolutely critical. A centralized communication platform also will improve operational workflow as well as allowing clinicians to get real-time updates on orders, results, tasks, and really eliminating duplication of effort and actions. So when we're talking about the current care coordination workflow problems, there are numerous that we can all relate to. In fact, there's probably different disciplines on this call right now that you can see that from your point of view. So there are endless examples of this in situations where clinical team members and nurses and doctors and surgeons need to quickly collaborate to update and adjust treatment plans for patients. And to enable efficient communications between care team members, you must be able to access patient information, collaborate with the team, and have access to decision support tools. However, in most scenarios, care team members lack access to patient information, poor or redundant communications about patients, complicated and time-consuming point-of-care handoffs. In fact, the Institute of Medicine study in 2010 found that an average cost for a patient visit with uncoordinated care were 75% higher than patients whose care was coordinated. So the problem that I mentioned is going to be highlighted in this workflow, and I'd like to share with you a typical example of a mid-sized hospital. And this is personal to me because this actually happened to one of my loved ones, and I got to witness this not only as a technical person and a technologist, but I got to witness this as someone who understood healthcare and how it works. I asked a lot of questions, probably frustrated a lot of care providers, but certainly had a better understanding of this communication workflow problem. So we have a patient who was admitted for an acute myocardial infarction, or AMI, or commonly called a heart attack. And during their stay, the patient complains and feeling not easy and or kind of uneasy and not feeling good, and reaches out to the nurse. And the nurse checks the patient's vitals and decides to get in touch with the doctor. So the nurse pages the doctor and waits for 10 to 15 minutes and did not hear back from him. So the nurse is not sure of the doctor's location, so she goes ahead and calls his cell phone number from her workstation and leaves a voicemail message. Of course, the doctor is busy with other patients, and rightfully so, and the doctor calls back eventually in the nurse station and leaves a message for the nurse because, of course, the nurse is calling and actually tending or rendering care to other patients. So the nurse is immediately paged, and she calls him back, and this whole process takes about an hour. Meanwhile, the patient is still uncomfortable. So the nurse actually connects with the doctor finally, and they start discussing the patient condition. And, of course, one question leads to several questions. So the nurse logs into the EMR, and then the doctor logs into the EMR, and they have to go find a computer. And now they're talking about doing some additional tests to revisit the current treatment plan. So he orders new tests. So now the nurse must follow those tests in the new order and locate those results. Then the results then need to be communicated to the doctor, who's also busy with other patients. And after tracking down the doctor, and the doctor then would say, in this particular situation, is going to go out to a consult with a specialist. And then after that consultation with the other doctor, they decide to change the prescription and calls the nurse. And so now the nurse is informed of the new change. The nurse follows up with the new treatment plan and keeps the doctor informed on the patient progress. This is a typical scenario performed by most nurses. And according to a recent Cisco survey on hospital nurses, 86% of respondents estimated wasting up to 2 hours per shift. It's 2 hours per shift, chasing others to get answers on patient care. So at some point, we're going to have to induce some technology, which is really already there in the hands and on the side pockets of the care team, and we have a solution that can obviously take care of a lot of this and alleviate a lot of this pain. So what I'd like to do now is I would like to turn this over to Heath Long. Heath is a former CIO of a mid-tier large clinic. He also is our current product manager for IQMax. And what he's going to do is he's going to take us through a live demonstration of our product and showing you what we've done specifically around alerts and messaging. And he'll give you a good example and live demonstration of that product. Heath?
Okay, thank you, Paul. Thanks for the introduction, and thanks to all the attendees out there for joining our webinar today. As Paul mentioned, I'd like to just walk through a brief demonstration of our IQ Communicate product and show you some of the features. We're going to walk through a couple scenarios here with this application to kind of show you how our application can help facilitate some of these care coordination and collaboration needs within the clinical environment. So if I could draw your attention to the screen share that I have there, what we're looking at is an iPad. So I'm actually doing this on an iPad. One thing that I will point out is that this application is very device and mobile platform agnostic. As you can see here, again, this is an iOS platform. The application also works across Android, BlackBerry, Windows, mobile, and phone, as well as it also has a desktop component for desktop workstations. So it really does help facilitate some of the other initiatives out there, specifically around BYOD, or bring your own device. So what we're looking at, you'll notice that I have the notification center pulled down on the iPad, and you'll see that I have a couple of notifications there for me from our application that are in reference to some text messages as well as alerts. And so I can go ahead and just actually launch into the application. I'm currently logged out, so I'll tap on one of those notifications. We'll look at the text message first from Dr. Brown. And because I was logged out, it's going to prompt for login credentials so I can access the secure messaging components as well as some of the other clinical components. And then what that does is that's actually going to bring me to the particular message or event, such as an alert or a task, that that particular notification was in reference to. So we can see here that I have a text message from Dr. Brown, who is an ED doctor, and it's in reference to a new admission. This patient was admitted experiencing an AMI event. And you'll notice within the scope of the conversation screen here that we have this conversation is actually a text message that has a patient's information attached to it. So we can tell that by at the top in the header of the header of the message window there, we can see that this is in reference to patient Alex Holmes. And if you look at the bottom of the message screen, you can see that there's a drop down there that also has Alex's information in that. So if I had multiple patients attached, or multiple admissions in this scenario, those could be attached to the conversation, and I could select the patient. So this was sent to me again. Patient was admitted experiencing an AMI event. So I can actually tap now from this conversation, tap the Go button next to the patient name at the bottom of the screen, and that'll actually bring me into some of the integrated clinical data that we have in the application. And so from this, you can see there that I have access to some patient demographics, but there's also a drop-down on this screen that will allow me to access other clinical and application components such as fluids, medication lists, lab results, vitals, those types of things. So I can actually go in now for this patient, select their labs by tapping on that, and I can go in and look at, as a user, the relevant real-time lab results or medications, whatever they may be in this case. And so from that then, you'll notice that I have a return to conversation button at the bottom of the screen in the blue bar. So from any of those components, I can, with one tap, instantly go back to this particular conversation, and I can formulate my response. So in this case, I'll just respond back and say to Dr. Brown that I'll order a test here. I'll order a troponin. Panel and send that away. And then one of the other things that our application allows us to do is I can also forward message component or messages as well. So I want to now alert the particular nurse to this event. So I'm going to select that and select forward. And I'm going to, which will then bring me into a forwarded message window. And I can go up here, tap on the ellipsis button, and go into contacts. And I can select the particular recipient for that. So I want to send this to the RN on call. I'll select that user. And then I can go ahead and send that message away as well. So there we can see with that, that's just one example of a patient contextually linked conversation between multiple parties in that. So that really, hopefully you can draw some information there that's a time saver, especially when you're comparing that to sending and receiving pages, trying to locate an available computer workstation, et cetera, then trying to log in and search for all of that information and finding those people as well. All right. So the next thing I'm going to do is I'm going to tap Patients here, and I'm going to actually go out because this is an integrated, because this solution is integrated with my census and other clinical information. I have access to a full census list or my patient list. And so what I want to do now is begin to create a conversation here. So I'm going to take the role now of actually the role of that ED doc. And in this case, I'm going to have, let's say we have a patient. I'm going to select patient Baron Tanner. And I'm going to tap on that green message icon next to his name to create a new message about that patient. So this patient is presenting with apparent broken jaw. And so one of the things that we can do with the application as well is you'll notice there is an add button on the new message creation screen. We can actually securely attach or capture images directly from the application. So I'm just going to select Take Photo, and I have an X-ray here on my second monitor. Capture that with the device's camera. And then I can annotate that message by tapping in the new message box. And I'm going to send this to my orthopedic group, and I'm going to ask them if we need to prep this patient for surgery or admit for a follow-up. So I'm going to go ahead and tap that message out. And then go up and select the particular group. And as I mentioned, I'm going to send this to my orthopedic group. There you can see within the context of our contacts, we also have the ability to maintain favorite contacts. So I've already created an orthopedic group. I'll tap on that. I'll select all recipients in that group. And so there, and send that away. So there I've created a contextual message with a photo attachment to a group as well. Okay. Something else that I want to look at is, if I can draw your attention now to the top of the screen, you'll notice from my patient list that I have a banner there at the top of the screen that has a bubble in it that's highlighted in red with a 1. So what this is the notification area in the application. And so as new events come in while I'm an active user using the application, that banner area will display the number of events or messages that I have waiting for me. And also that color-coded bubble will give me an indication of what the criticality of some of those events or messages may be. So I can access my messages and events by tapping on the bubble. And that's going to bring up a quick action menu of message-related functions and features. And you'll notice there that I have also the ability to receive alerts. Okay, so I want to go in and take a look at these alerts. And here you can see that I have a critical alert. I can tap on that for more information on that. And we can see that this is in reference to a lab value. It's a VANT. There we can see the value as well. That's out of range or critical. And one of the things that you'll notice is that this particular alert is then contextually linked to that particular patient as well. So I can actually, so what I want to do with this is I want to contact the specialist for this patient. So I'm going to go in, look at the patient, and from the drop down I'm going to select new message. And I'm going to go in and pick that specialist out of my contact list. In this case, we'll send that to Dr. Brown. Okay, select that person actually. There we go. And I'm just going to ask if we should we look at a reduction in the dosage for that particular medication. And then we can send that away. So then you can see I can return to the alert now from that, and because I've taken action or facilitate some type of action around that alert, you'll also notice then that I can acknowledge the alert. And when I do that, that's going to tell the sending system, whether that be, in this case, it would be a lab system or some other type of third-party alert generating system. That's going to tell that system that I, as Dr. Smith, have picked up and acknowledged that alert. Okay. So a couple other things we'll take a look at quickly before we get back into the webinar here. I want to go to my inbox, and how do I as a user then determine how those particular alerts and text message notifications are going to be delivered to me? One of the things that we look at in the spectrum of how a clinician operates in their workflow is we want to try to prevent as much of that alert fatigue, so to speak, as we can. And so you'll notice here that there's a drop-down select in the inbox that allows us to configure how those particular event notifications are delivered. So we have the various event types that our communication system can send. I can go in and select that particular item, in this case critical alert events, tap go on that, and what we see here are rules that determine how these particular events will be sent to me, or the notifications of these events will be sent to me when I'm logged out of the application. So here you can see I have a couple of rules for critical alerts. The first rule there says that after 1 second of receiving that event, I want it to send a notification to a device. And then you'll notice below that I have a drop-down, a device drop-down that says Heath's iPad. In the case that I maybe want to carry multiple devices, I could easily go in and pull down in that drop-down and select any other devices that I have registered with the IQ Communicate application. So if I wanted to switch over now and say, I'm leaving my iPad in the clinic or hospital, I want to take my iPhone with me now, I can instantly quickly save those changes for those alert notifications now to go to my iPhone. We also can create sort of an escalation path with those as well, and you'll see that by the secondary and tertiary alert capabilities that we have, or notification rule capabilities that we have. So I have a follow-up rule here that says, after a minute, I want it to email me, or I could send that I could have that send that notification to another device or another user. So we have those capabilities as well within the solution. One other thing that I'll mention, I want to return to the patient list, and that is something that we call the patient wall. And so you'll notice that next to the patient name, we've already addressed the green new message icon, but there's also a blue icon there. And if I tap on that for Adam Cleveland, this is going to bring up the patient wall. And so what the patient wall is this is a conversation that is dynamic. It stays with the patient throughout their encounter, throughout their stay. And so what this allows users to do is any user who is associated with the patient or part of the patient's care or treatment team can go in at any time and view information about the patient that you may not necessarily typically include as information as part of the permanent record, but information that is relevant to the care of that patient. So here you can see that there are a few messages in regard to the patient's family being there and the patient's not resting, etc. So I could go in and add more information. I could add an update myself for that patient, attach images as well with that. So with that, that concludes our quick demo of this. And so with that, I will turn the presentation back over to Paul for the rest of the webinar.
Heath, thanks a lot. That's a great job in the demo. Appreciate that. So as we look for specific goals on the IQ Max Communication Suite, and as we looked at building this, we really centered around core key aspects, and this is probably very similar to what you're doing from an organizational level and looking at mobility. And one of the things we want to do is we want to keep caregivers and support staff connected through simple and real-time flow of information. So we want to also provide the right information at the right time on the right patient to enhance care coordination amongst the care team. And we want to leverage the smartphones and the mobile devices and the tablets, whether you're purchasing those as an organization and buying, say, an inexpensive iPod Touch, or you're allowing your employees, whether owned or people who have admitting rights, practicing rights to your institution, bring their device in, BYOD or BYOT. So we had to be able to leverage that, and that's what we've done with our platform. We also have to integrate tightly with EMRs, EHRs, and call management systems. And from an IQ Max standpoint, we've done that with over 60 different types of integrations with those type of systems. And the other thing we wanted to do is we wanted to remove these single-minded, bulky, clunky, expensive devices like pagers and IP phones and call management, call center systems. And we want to reduce that administrative overhead and cost and burden from that standpoint. So very similar to what you're thinking of from your own institution. One of the things that we have done from a communications platform is we've really broken this down into kind of 3 areas, or segmented this into 3 areas or groups. There's simple messaging, which Heath demonstrated and talked about that. There's also messaging with integrated patient details and patient record information. And that's peer-to-peer, peer-to-many, with both images and documents. We demonstrated alerts and notifications, and whether those alerts are generated by a third-party system or custom clinical surveillance tools that we can do for you as an institution or as a group within your institution or an individual. We can have that from alerts and notification. And something we didn't have an opportunity to talk about, but we'll do that in a next webinar, will be task and workflow management. And that's the ability for you to assign tasks, for you to accept and reject those tasks, and for those tasks to be tracked. And so you can manage the task list and the response times. So that is part of our total communications suite when doing this. I'd like to go a little bit more into detail about the messaging around the improvement of care coordination. So the IQ messaging can help improve care coordination by enabling physicians and nurses and really any other care team member to quickly text message and share pertinent patient information securely within any environment. This eliminates tracking down team members via phone or pagers, and also integrated clinical data and communication functionality into one application, enabling clinicians to communicate and truly collaborate with rich multimedia and rich patient information. So here's an example that we've done. It's a very simple example where an ED doc sees a patient with a broken jaw, takes a picture of the jaw, sends it to the on-call orthopod, and the doc asks if he should go ahead and prep the patient for surgery or admit him for follow-up the next day. The orthopod quickly replies back to prep for surgery. The patient is prepped for surgery, so the right care is immediately given, and the ED doc copies the nurse and the hospitalist to inform them of the patient's situation. So easy and straightforward from a messaging standpoint and care coordination. Now when we look at the improvement of care coordination with alerts, we can see that the solution is designed to receive several types of real-time alerts from clinical systems and deliver those alerts to the right clinician based on predefined rules in the setup process. We can also configure these rules based on any clinician's need, and we can do that on the fly. One important aspect of the workflow is returning to a read-receipt type notification to the clinical system so the alert is marked as viewed. So here's an example of an alert function that we're using, and it's integrated alert management solution. So the nurse receives an alert on her device from a bedside monitoring device. The nurse then messages the physician regarding the patient. The nurse receives notification that the doctor has reviewed the message. The doctor reviews the alert and sends a message to the specialist on call with the patient's information. So that chart is built into that message. The doctors collaborate and agree to order a new test. The nurse receives a message and the new test is ordered. The new results have arrived and the care team receives an alert. So the doctors and the nurses will receive an alert about that result has arrived. And the doctors review the results and take immediate action to change the treatment plan. In our next example, we're talking about improvement of care coordination with task. So our task solution is designed to integrate with any third-party scheduling system. So the application is designed to allow tasks to be assigned to appropriate clinicians based on their availability and responsibility. So acknowledgments, declines, reassignments, and completions are all tracked, and tasks can be triaged based on their priority. So here's an example of a task solution. So the nurse gets an alert on her device. The nurse studies the patient's situation and sends a secure text message to the doctor regarding the patient, including the patient record. Nurse receives a notification that the doctor has reviewed the message. The doctor reviews the results and requests for a consult with a specialist again, sending the message with patient information. After the consult, the doctor decides to change the treatment plan and orders new prescription and assignment of a task for the nurse. The nurse received the task notification and task action. The doctor receives the notification of a change in the drug administration, and the nurse uses our patient wall, which Heath just demonstrated, to update the patient status. And this allows the current care team members to be informed. The patient wall also allows the next shift care team specific notes about the patient and their care that are not necessarily needed to be a part of the EMR record. So it's a very unique function. So as we're moving down the road, you can see that communications from a text messaging, from a task, from alerts is a huge part of our communication suite. And we are working with our customer and developmental partner, Novant, in also delivering voice, and that is using SIP integration to integrate with the back-end PBX communication system of the hospital. So we'll also add in video, which is a later project, but right now focusing on the ability for a clinician to go in this case, I am Dr. Doe, I'm tapping on Alex Holmes' patient information. I'm looking to speak with the nurse, so I look at the care team, I tap on the nurse, and I can instantly call that nurse. And when that nurse phone rings, she accepts, and that patient record, Alex Holmes, is on her device, and she is ready, on point, on target to talk about that patient, Alex Holmes. So with that in mind, I'd like to introduce to you guys our customer and development partner, Novant. Novant Health is a nonprofit integrated healthcare system. It includes 13 hospitals and 349 clinics and really stretches from basically just below D.C. down to Georgia and has basically every type of care. I am happy to introduce our partner and, again, customer and developmental partner in a very unique relationship in that we're leveraging both technology from IQMax and clinical IP to really develop a very integrated, comprehensive healthcare solution around communication. So I'll introduce you to Dr. A.J. Patefield from Novant, and I'll let him talk a little bit about our relationship. Dr. Patefield?
Thank you, Paul. And thank you for the introduction. It's a pleasure to be here. I've been working with Paul and his team now for probably the better part of 3 years, and are now in the process of an implementation of the secure communication and patient information to a 300 to 500 group of physicians across our 13 facilities. That's going well and is very well received. We do not yet have good feedback on the secure communication, at least from my perspective, to know that they're reducing their non-secure communications within the Verizon and AT&T networks and transferring it over to the IQMax network, as we hope that they will do to maintain that security. The ability to be able to communicate with the patient in context has been very well received for the efficiency, and our physicians certainly recognize the reduction in errors through fat finger errors that are possible through normal text messaging. The drivers for Novant were all of those that have been talked about previously in the presentation. We have increasingly less reliable pager systems as our cell towers are not being renewed with our pager vendor. We have the proprietary wireless that support a few IP phones, but not nearly the penetration we expect to be able to get with our physicians and employees to move to standard technology like iPod touches and something much more affordable than some of the proprietary networks. So we're very excited that we can leverage that kind of technology, eventually moving to the voice integration to be able to connect directly our physicians with our nurses in a secure fashion. We would like to, although it's not on our project timeline quite yet until we have moved more successfully around the alerts and acknowledgement and the voice, but we do certainly envision a connection to the patient and the patient's care team to be able to bring that out of our EMR, connected to a communication layer that is not dependent on our clinicians being inside the electronic health record but rather can get visibility to activity in the electronic health record through this mobility platform that we're increasingly deploying within Novant. Thank you, Paul.
Thank you, AJ. One of the things from a Novant standpoint, they have several different EMR, EHRs. They have been installing Epic right now, so we've integrated with Epic in that install. And one of the unique things about the Novant partnership that we've done is they have an innovations lab, and they've set up several different systems, PBX systems, that we're now integrating with in this lab and being able to test. And it's been a very good relationship for us, and the rollout and the process is going on right now. So thank you, AJ, for joining us. I appreciate that. So a little bit about IQMax. We talked a lot about our solution, but the history, I think, is just important. We've been around for really almost 13 years. We have an in-depth platform that we built from ground up. So all of our IP and intellectual property is owned by us. We have extensive in-depth integration knowledge and expertise and built our integration engine, again, we own. That's very important as we're not reliant on any other third-party vendor to integrate with and held up in the process. We have had multiple different decision support tools that are on the mobile device. Rounding that you kind of saw a little bit about a rounding in Heath's demo, but we also have charge capture and a dictation application, again, plugged into that platform. Very flexible deployment options for both an enterprise within the walls deployment as well as a in the cloud or SaaS model. And implementing this is really in almost a Lego phase. We can implement all the applications, one of the applications. We can deliver those to an institution or a group or an individual, so it's a very flexible implementation models. As Heath pointed out, one of the uniqueness about us is we have both a hybrid and really a hybrid application, which kind of goes between a thick client and a thin client. So it's a hybrid application that really enables us to have really any internet appliance. So it makes it from a deployment standpoint very easy to deploy, as you have devices that you may own and then devices that you may inherit via different caregivers who are wanting to use their own device. So it makes it very easy for you to implement from that standpoint and manage those devices. So supporting virtually any operating system, Android, BlackBerry, Windows, and if you saw us last year at the HIMSS, we had it set up in an Xbox at the Microsoft booth. So it works across that. So that's a little bit of history about IQMax. Certainly the founding focus when I founded this company was really to leverage the computing power of what I saw a phone and a PDA, which is hardly ever talked about anymore, and leveraging those two together to really formulate a powerful enterprise tool. And we built this platform ground up with healthcare in mind and delivered it to the healthcare market. So with that in mind, we will move into our question and answering. I will turn this over to Heath, and Heath will help us manage and go through the question and answering session. Thanks, Heath.
Okay, thanks again, Paul. So we're getting quite a few questions in. Let's start out with one here for Paul. So question is, Paul, is our application able to integrate with Epic?
Well, we actually are integrating with Epic at Novant. So we're integrating with that, so the answer would be yes.
Okay. Getting several questions actually around integration. What systems does IQ Communicate integrate with? So as Paul mentioned, Epic, of course. Siemens was one of the questions here. We've specifically integrated with Siemens, both in the lab diagnostics as well as the imaging side. I believe we've interfaced and integrated with over 60 various types of systems to date. So another question here is the text message integrated with the patient's medical record? So yeah, any messages or conversations that are specifically in the context of a patient, like when I went in and attached a patient to a conversation, and those couple of examples, as well as the patient wall, those types of things, can be linked to the encounter for that patient. So what we do is through an interface, at the end of the encounter, all the text messages for that particular encounter, as well as contents of the wall, etc., we can make those available through an export interface to the host EHR, or they can be archived for storage on site as well. Another question here in regard to messaging and alerts. Is it possible that I do not get a message or an alert due to over quota of my mailbox? So the way that the application works, we actually do not enforce mailbox or user quotas. So each user has the ability to receive, an unlimited number of those events that I talked about: text messages, alerts, tasks, those types of things. Typically, older messages, messages that are older than a month, we usually archive those off, and that assures that we have ample storage space on the host servers. Question here: what if a provider does not have a smartphone or a smartphone device? And how do we ensure reception throughout the hospital? That's a two-part question, so I'll answer the first part of that. So in the case of a provider maybe not having access to or choosing not to carry a smartphone or a tablet or a mobile device of any kind, as I mentioned in the beginning of the demo, the application also has a desktop workstation component in which the user can access it securely via the web browser on that particular workstation. So then the way that the notifications work with that is any of those alert, task, or message notifications can be configured as we saw in the drop-down for the notification. Those can be sent to an email address as well. So the provider actually would receive the notification to their email. It would be a link that they access, click on, that launches the application and prompts them to log in to view those items. Are we able to audit text messages sent and received? And can you text from desktop client to mobile phone? Yes, we do have full audit and logging capability within the application. We have a system management component that goes along with that allows administrative users, etc., to go in and audit and view those events. And can we text from a desktop to a mobile phone? Yeah, actually the way that we're getting several questions in regard to the security around the messaging as well. So the way that works, it's not actually texting from device to device, but it's more user to user. As Paul mentioned, this is a hybrid web application. So one of the things that you see with the way that our application works is that none of that PHI or any of the contents of those text messages is ever really stored or contained on that physical mobile device or desktop. So it's more of a user-to-user messaging methodology there. Another integration question. Can we integrate with Meditech? Yes, Meditech is one of the systems on the list that we have successfully integrated with before.
And just to add a couple points on the integration, I think we've done McKesson, Siemens, Cerner, Epic, Meditech, Misys, NextGen. Those are just the ones that are coming to name right now. But like he said, there's over 60 that we've integrated with.
Okay, Paul, I think we've covered the majority of the questions here I'm looking through. So if there's nothing else, I believe we can go ahead and hand this back over to Eric at this time.
Thank you, everyone, for joining us today. If you would like to view the archive of this webinar or share it with a colleague, please visit the on-demand webinar section on mhims.org. Thanks again, and have a nice day.